We love the holiday season and the joy it brings, and as parents and spouses, we all work hard to try to bring joy to others. The problem is we work so hard, we may be working ourselves into some serious health problems because of the added stress of it all. You may not know it, but the period of December 21st to December 25th, Christmas, through January 1st, is the most deadly period in the calendar for cardiac deaths. And we aren't trying to scare you, but we are trying to give you a little warning of that. Excuse me as I choke. Dr. Jelena Arnautovic is the interventional cardiologist at Ford Macomb Hospital, and she joins us this morning to put this all into context for us. Doctor, good morning.
Good morning. How are you?
We're good. Is it all about those pressures and the stress and trying to pack a lot of fun into a very few days?
Well, certainly the holiday season is one of the happiest times of the year, and we look forward to it. But with the stress that it's often accompanied by, it can be a dangerous time for our hearts. Heart attacks, strokes, atrial fibrillation, heart failure, and other related heart conditions are definitely more prevalent around this time of the year. And, American Heart Association found that heart-related mortality and deaths is at all-time high during this holiday season.
And doctor, research shows that heart attack deaths mostly are people not in the hospital. So that's why it's important to recognize the symptoms. Say if you're at a holiday party yourself or you see someone going through it, what are the symptoms?
Absolutely. So some of the major symptoms that we see, and we call them a classic heart attack symptoms, and those particularly we see more in men, are heavy, crushing chest pain, pressure in the middle of the chest, or sudden or unexplained even shortness of breath or feeling like you're going to pass out. And some other symptoms that we typically see more so in women are a little bit different, and it can be more subtle, more diffuse. Women tend to have more shortness of breath, more so profound fatigue, and occasionally they might feel like dizzy or lightheaded, and often they don't have typical symptoms like men do. So some other things also that we like our listeners to be aware of is also not just the signs of a heart attack, but also signs of, sudden loss of sudden onset of face drooping, arm or leg weakness on one side, or even speech difficulty. Those are also can be signs not of heart attack, but stroke, actually.
Dr. Arnautovic, I have to say I'm guilty of this, and I've seen this happen. When you get around the holidays, you get excited. A lot of people are traveling, they're going places, and they may be on medication, and they forget it. And they don't have their medication. So what do you do? What do you do about that? I mean, you really have to stay up on your medication.
Well, absolutely. Just keeping up because we get so busy during the holiday season. But keeping up with your regular checkups with your healthcare providers, and staying compliant with your medications, and not forgetting to take them, or take them with you when you go places. Keep them next to your toothbrush, not to forget them. And that's very important to protect yourself and avoid any cardiovascular complications during the holiday season.
When you look at this scientific research that was published in Circulation magazine, the American Heart Association says Christmas Day is the deadliest day for heart attacks, more than any other day of the year. The second largest is the day after. How much of that is because folks do feel symptoms, but they say, I'm going to ignore them. I don't want to ruin the families.
Ruin Christmas.
Yeah.
You're absolutely correct. I see this quite often when I take a call on Christmas and after Christmas as well. And often our patients will come in and they'll say, well, this cannot happen to me. And they're too quick to dismiss their symptoms, and they're just, they don't want to bother their loved ones. They don't want to be a burden to anyone. They want to enjoy the season, and they just dismiss the symptoms. They're thinking, oh, this cannot happen to me. That's the most common thing that I see during this time. And certainly the overstress takes over, and then we just don't realize what's happening to us.
Well, and I think I've been guilty of this. There was a thing that was bothering me, and I said, well, I'll take care of it after the first of the year.
Right.
Yeah.
Absolutely. This is my New Year's resolution. I will worry about this later. I would not. Absolutely.
Yeah, meantime, pass the eggnog.
Correct.
Um, uh,
Correct.
we're supposed to celebrate in moderation. That's tough sometimes, but that includes eating and drinking, correct?
Um, Absolutely. So I call it big 4 O's during the holiday season. I speak to my patients about this all the time, like overstressing, overexerting, overindulgence, and overdrinking, right? So, but if we talk about overindulging, holidays all about the food. And what common holiday foods are very high in salt, saturated fat, and sugar content. So this can significantly impact our blood pressure readings, blood sugar, cholesterol, and long term, this can lead to diabetes and definitely other types of heart disease and related problems. So, I mean, this is ideal time when we establish like the new resolutions and start to maybe come up with some new healthy dishes for upcoming holiday festivities. And maybe I suggest incorporating more Mediterranean and plant-based dishes that should be more present in our menus during the season, and keeping our serving sizes in mind, eating that extra veggie and protein and taking it slowly, and allowing time for digest and heart to rest during eating as well.
And doctor, just winter weather altogether, I mean, including these cold temperatures, can trigger increased risk of heart attacks.
Absolutely. That's overexerting ourselves, trying to multitask. We just have to resist the urge to do it all, right? Between decoration, housework, event planning, trying to stay fit, and even shoveling snow that's coming, right? It's critical to do that, but also we have to be very careful because that can add significant heart strain. And what I recommend is just to take it easy, try not to do it all, and be aware that spending time and exerting ourselves during the cold weather can put a strain on our heart, and then we can start feeling some of these symptoms, not to ignore them, not to wait for them to go away, but to seek help right away.
And can I just say, we tend to think of this anytime we have these discussions, we tend to think about the men. In my family,
Absolutely.
it's the women that put the most stress on themselves to make everything perfect for the holidays. And it seems that they're the ones that are putting the most stress on themselves.
And women die of heart disease.
Mm-hmm.
Very much so, very much so, and we cannot emphasize enough how often we as a women we ignore our symptoms because we just want to do it all and be there for our families, keep everybody together, and often we just dismiss our symptoms and we tend not to seek help in time.
Mm-hmm.
And especially as I mentioned earlier, our symptoms are not the same, and that seems to be quite troublesome for us.
Well, I love the fact that in this list of do's and don'ts that you've given us, one of them is plan for peace on earth and goodwill towards yourself. Take care of yourself, and I would also add to that, take care of your spouse. Watch for symptoms of stress, and if they show these warning signs. Doctor, thank you so much. Have a wonderful holiday.
You as well. Thank you for having me, and stay happy and healthy in the new year.
We're going to do our best to try. Thanks so much. And yeah, we'll give ourselves that gift.